We're talking breast health with Dr. Shweta Kurian, a medical oncologist and hematologist at MedStar Franklin Square Hospital and the campus in Bel Air as well. We're talking about cancer treatments and therapies. Doctors, thanks so much for joining us in studio.
Thank you for having me.
Talk to us about the targeted cancer therapies.
So targeted cancer therapy is very specific molecules that basically target certain receptors either on the surface of cancer cells or inside the cancer cells. Now these receptors target or they control pathways involved in the growth and spread of cancer cells. So when you use a targeted therapy, it blocks these receptors and blocks those pathways, preventing the tumor cells from dividing and spreading.
So is everyone a candidate for this?
No, so not everybody is a candidate. You have to have those specific receptors on the tumor cells to be a candidate for receiving these treatments. So let's say somebody has lung cancer. They have to have a specific receptor called EGFR mutation. And when they have this receptor there on the surface of the cells, they are able to get the targeted therapy, which is Tarceva. And it's the same way, there are different cancers, different receptors, and different targeted therapy.
So talk to me about the impact that these targeted therapies have on cancer treatment.
So it's very interesting. You know, we used to see where we had conventional chemotherapy and we treated all the tumors the same way with one chemotherapy that acted on all fast dividing cells, because cancer is a fast dividing cell. But that what in turn did is affected all fast dividing cells in the body, and that's why people would lose their hair. They would have skin problems, they would have ulcers in their mouth, diarrhea, blood counts going low, because these are all fast dividing cells. But targeted therapy target the tumor cells specifically. So the side effects are much lesser.
That's what I was going to ask. Less side effects.
Less side effects, tolerated better, and you could tolerate the same treatment longer period of time without having the nasty side effects that you see with chemotherapy. Now, having said that, they do have their own set of side effects. You know, we're not there yet where we target only specifically the cancer cells. It still affects certain other normal cells which may have the same receptors, but we have come a long way. Now we're moving to something called immunotherapy, which is a cousin of targeted therapy, where we are potentiating our own immune cells to recognize the cancer cells, which look very similar to our own cells, and our body's immune system is not able to recognize them. But these immunotherapy are able to potentiate our own army inside and attack those cancer cells and kill them.
We're getting there.
Yes, we are. We surely are.
All right, Dr. Kurian, thank you so much. Again, we're still taking your calls next door. The number to call is 410-481-2222. Dr. Kurian is going to join us in Focus at 6 o'clock and talk a little bit more with Jamie about some of these targeted treatments.